So during the Great Resignation, one of the biggest focuses was, how are we going to be able to treat our patients? Because the demand was just out of control. And so my team wasn't just focused on getting individuals in the door. They were focused on building capacity in our hospitals. So I think if you can put a mission behind what you're doing and understand the why behind being faster, it'll help get everyone behind you.
So what does it really take for your business to attract world-class talent today? I'm Dave Travers, president of ZipRecruiter. And on Talent All-Stars, we shine a light on the people and the day-to-day processes behind recruitment and retention at some of the world's most influential businesses. Picture this. You have your first day at a new job in the healthcare industry, and the country announces a lockdown for COVID. Pretty daunting. Well, for today's Talent All-Star, Jacquie Liddell, that was reality. Jacquie is the Vice President of Talent Acquisition at Mass General Brigham, a leading healthcare system in Massachusetts. Before that, she worked at Randstad SourceRight, a company specializing in TA innovation. Jacquie Liddell, welcome to Talent All-Stars.
Great. Thanks for having me.
Bring us back to that moment. What was it like day one, and what were the challenges in front of you at that time?
Sure. So I actually started the day that Massachusetts went into lockdown. So the Friday before, one of my coworkers or soon-to-be coworkers called and said, hey, can you pick up your laptop today? We might not be in the office for a week or so. And I said, okay, no problem. I can do that. So my husband drove me with the kids because they were already out of school, picked up the laptop. And then I would say Monday was not your normal onboarding experience because things were a bit hectic. To begin with, I think we were all trying to figure out what was going on. But then it quickly became very, very busy and engaged project work. So I helped with Boston Hope, which is the field hospital that they opened. And then we also were working on finding and attracting travel nurses. And so my experience from Randstad, where I worked in staffing before, really played into that. So I was quickly able to help supplement our MSP that we had that was helping with travel nurses and added a ton more vendors to help meet our demand, being such a huge hospital system.
Yeah. So talk about, I mean, we all saw the headlines, but talk about what was it like really being there? What were the stakes for getting enough nurses at that time?
It was a lot of late night phone calls with vendors and trying to figure out what the right pay rate was. There was truly like life on the line, right? Because if you weren't staffed properly, if we didn't have the right people to support our own employees, then we weren't doing our job. So there was a real sense of just urgency and everyone really working together to make sure that we were able to meet all the just different demands that came through. Every day was significantly different from the previous day. And we had so many kind of unknowns or we've never done that before. And we were just trying to kind of figure it out on the fly.
Yeah. I mean, healthcare is an industry where there's more regulation for understandable reasons. There's more regulation than a lot of other places. So you can't just find a warm body to go into an ICU and be a nurse in a situation like that or at any time. So take us through, like, how long into your job was it when you felt like, I've got this, like I'm finally on top of this crazy situation I found myself in?
Never, right? I always feel challenged in a good way in my current role and during that time. I think that the urgencies maybe changed. Now we have different problems than we had then, but I think healthcare keeps you on your toes, which personally for me works well. I like always having new challenges and having to look at things differently. So I guess long answer short, I've always kind of felt challenged and we've always had kind of new and interesting things happening.
Yeah. You referenced earlier that one of the things was thinking about long-standing practices that you had to question and say, well, we've never done that before. How do you think about that in a situation where there's still some rules we're going to uphold that are really important for the betterment of our patients and for our whole healthcare system, and yet we're in this crazy situation and crisis where we can't just do it the way we used to do it? How did you weigh which rules to bend, which rules to break, what to uphold?
We worked closely with compliance and our OC health department and figured out what are things that kept our patients safe that we needed to continue in our practices. And then what are things that were kind of nice to have through that we had in our onboarding process that maybe weren't mission critical. We also worked closely with our vendors at that point to see what other hospital systems were doing to make sure that we were meeting the emergency crisis credentials at that point in time. But yes, you couldn't spend the 6 to 8 weeks that you spend to onboard nurses that we do now in a time where they needed to be there like in a week or so.
Two things there that I love. One is first principles thinking. Like, let's think, why do we have this operation? Is it because there's a hard legal requirement that we do it? Or is it because this is the way we've always done it and we should question it? And then secondly, I love the idea of using vendors among the network of people that have connectivity into how other people are solving the same sets of issues. Like, how do I think creatively? Who do I know that is facing the same challenges and what are they doing that I could learn from and potentially vice versa? Do you remember a specific example of a change you made that felt scary or different, or was a we've never done this before moment?
I think just changing our onboarding credentials, because we had them for decades and that had been always our process. So it was like, well, who's the approver for this? And like, who can okay it? And so just getting the right people in the room to say, does this make sense? What do we need to do to be compliant? And then swiftly making those changes. And like any change management, people are like, oh, they didn't finish all their credentials. It's like, no, we have crisis credentials. That's what we're using right now. So it was just change management, making sure everyone was communicated to that needed to know. But I think that it was the ability to get all of the people in the room to make decisions really quick and be more agile. I think that helped kind of move things forward. We have since gone back to our normal onboarding process, which most other hospitals have as well. And that obviously was our goal to eventually go back.
And so one of the interesting things about your path that you referenced was that you came previously from a service provider and you went over to the client side. How did that help you, and how did that give you a different perspective from having served multiple clients and at the same time not having come up through the organization? What were the things that made that leap more challenging for you?
So one of the easier parts was they were with my client, so I knew them for the past 9 years. So I had a lot of relationships. I don't think I would have been as successful onboarding remotely had that not been the case. But I think my experience working with other places and seeing how they did things, especially one of my clients was in the energy sector. So they had a very strong emergency preparedness program where everybody had an emergency job if there's a utility issue. And so I was able to kind of figure out with the team, maybe we need to divide and conquer versus everyone doing the same things and set up more of what is your emergency role in this scenario? Also, a lot of my vendor relationships really helped during this because we had to lean on them. So having strong vendor partners with the travel nurse companies, with the Ronstadts of the world helped because we did need to bring in and augment a lot of our staff with staff from Ronstadt and from AMN and IA and those other firms.
Yeah. So having a variety of different people you can call on in a crisis who can be helpful, provide perspective, provide more hands to spread the work around, et cetera, obviously. So think back to earlier in your career where you weren't yet an executive inside a major organization where you were doing this. What were the moments where you realized that maybe just being somebody who helps, in the recruiting process specifically isn't my calling? Maybe I'm a person who will lead a whole organization of people doing that. And what caused you to think about that being the leadership mantle and going and becoming an executive being part of your career?
I think to start off with, maybe I wasn't finding my place or my dream career. So it took a minute and that was difficult, right? Because you leave college and you think that you're going to instantly be in the right position and have the growth path. And that wasn't necessarily my story. So it took a little bit for me to find the right role, the right company, which for me was Ronstadt. They had a really fabulous training program. They had a lot of leadership training. And so I was able to start getting that exposure. And then eventually was promoted into a program manager, which is basically your entry level manager role. And then from there kind of go up the ranks. But I would say anyone that is trying to figure out what their career is and not sure if HR or TA is for you, I looked at it as I knew I loved recruiting. I know I love getting people jobs. It's a passion of mine. So I knew that was a core thing that I wanted to stay with and try to figure out what the right place was for me. And then within staffing, there's just so many options. You can work at a corporation, you can work for an RPO, you can work for an executive search firm. There's call center staffing. So I think it's finding the right role and the right environment for you. For me, it was definitely healthcare. When I looked at my client portfolio within Ronstadt, I always found that I was spending the most time at Mass General Brigham. I was the most engaged in that work. So I just knew that was kind of the right place for me.
Yeah. And one of the things you touched on there that as you rise up the ranks, I think is easy to become disconnected from as you're being an executive, as you're managing resources and managing teams, et cetera. You talked about your passion for finding people jobs. So as you think about that, give us your perspective. When did you discover that? When was the moment you discovered that about yourself? And how do you use that to motivate you? How does that play into your passion for what you do today?
Sure. I think that there's pivotal moments in everyone's life, right? And one of them is accepting a job opportunity and being a part of that journey, giving someone meaningful work is just, it gives me joy. And I've always just been kind of drawn to helping, and that's my way of helping. So that keeps me motivated. I remember when I first moved into management, it was really difficult for me because I missed the win of that instant gratification of giving an offer, having it accepted, getting the thank you. So finding my wins now is watching my team grow, watching them accomplish things, them sharing their stories about people starting in our hospitals. So you just have to find what the next piece is, right, to keep you motivated. And now being in a leadership position, it's seeing my team grow and all the amazing things they're able to accomplish.
Yeah, you're not just hiring the next person, you're hiring the next 10,000 now, Jacquie. So one of the things that you referenced a little bit earlier was going back to normal on the onboarding process. Talk about, as we've emerged from the immediate pandemic and the immediate aftermath, talk about what's the framework you use? How do you decide, hey, we're doing things different and better now. Well, this is a permanent improvement in efficiency or higher quality process that we're now going to make permanent. And what are the things where, like, okay, now that we're out of the crisis, we can get back to doing it the other way, the older way that makes more sense when we're not in an immediate crisis? How do you think about those two categories?
Sure. So I have two examples. One on things that we've kept. After the Great Resignation, we entered that winter. So it was December timeframe with close to 10,000 positions open. We're usually around like 4,000 to 5,000. That put us at 100 plus recs per recruiter, which if anyone that recruits knows that's not a great place to be. So we had to quickly prioritize which positions the team was going to be able to hyper focus on. And we moved them into recruitment pods. So we had a nursing pod, nursing support, support services, allied health, and a few others. And so those were roles that the team prioritized, and we put sourcing behind them and a bunch of other resources. We had always wanted to and dreamed of going into vertical recruitment. We just never had the buy-in. So a lot of our recruiters were doing department level recruiting. So anything from an admin to a senior nurse executive, it was just a hodgepodge. So this kind of pushed us into the direction that we wanted to be in, and we've been able to maintain that. So we still have vertical recruiters who are specializing in their given skill sets, and it's definitely helped with our speed to hire and our ability to stay on top of the market in their specialty spaces. So that's remained. Things that have gone back, we shortened our interview process to like one interview and asking people to make offers. I think in retrospect, we had to do that to get to the amount of hires we needed, but not giving people a full interview process with the ability to ask questions, with all the information that they need to make a decision. I think that that's an area of opportunity. So we are moving back to a more traditional interview process where you're talking to your TA partner, you're getting all the benefit and all the job details. Then you're speaking with the hiring manager and ideally a peer or someone on the team. So you really can go into the role knowing all the ins and outs of it. So, and I was reading some research in this, and it looks like during the pandemic, this happened everywhere where the interview process was hyper shortened. And I think companies are now going back to a more traditional interview.
Yeah, one of the interesting things in both examples you talked about there was speed and speed to hire. And this is something that intuitively, even outside of TA, you talk to any business leader, is being able to hire the next great person faster, better than being able to hire them slower, of course. But how much to invest in things like verticalized recruiting or the next system that will enable that is a big question mark often. How do you think about that? How do you make the case that speed to hire is something worth putting dollars and time behind?
I think it depends on what industry you're in, but if you're getting more nurses to the bedside or more allied health workers or x-ray techs, all of that to the bedside, then you're able to have more patient throughput. So during the Great Resignation, one of the biggest focuses was, how are we going to be able to treat our patients? How are we going to be able to maximize our capacity? Because the demand was just out of control. So we actually called it Enterprise Capacity Management was the project. And so my team wasn't just focused on getting individuals in the door. They were focused on building capacity in our hospitals. So I think if you can put a mission behind what you're doing and understand the why behind being faster, it'll help move and get everyone behind you.
I love that. So in the example of throughput there sounds like a, business school word, but when you think about it, what you have there is alignment between your mission of getting more patients treated and having them wait around less with financial results that funds the whole operation for patients, so that if you can not have downtime on the MRI machine because there are enough staff to keep the patients flowing through, that's a win-win for both the business and the mission of the medical center. And that makes it a no-brainer when you're advocating for resources to find that alignment between. So I love that answer. So now, as you think as a leader, think about now that we're getting back to this. Okay, we've adjusted back to status quo prior to COVID in some cases, and in some cases we've learned and kept our verticalization or other changes that we've made. What's the next mountain to climb for a massive organization that the whole community, for those that don't live in Boston area, MGB is a massive healthcare provider that so many people rely on. What's the next thing for you to be able to get the talent team to the next level?
Well, we're implementing Workday, so that's really our next hurdle and challenge. We're doing the human capital system as well as the ATS. So for me, Q1 or Q2 is really focused on stabilization, making sure the team is comfortable, that our hiring managers know how to use the system, and then rebuilding our applicant tracking system, because we're not going to be bringing over all of our candidates. So that's we're going back to basics. And then from there, we're going to rebuild our process flows in the new system, and with the goal of having it be a really strong candidate-centric experience versus just getting people through the funnel. So we want to try to add some hospitality influences into it so that people feel cared for and that they have really a nice process when they're applying for a job at MGB.
So I think the candidate experience and hospitality in a field of the economy where there's such shortages in some of the areas you're looking at, and there's such demand, there are so many choices for a nurse or other qualified medical professional to go a number of places, is so important. How do you think about taking something like that on to make the candidate experience something that is better tomorrow than what it was yesterday?
So we get a high volume of candidates. So I want to figure out how we can utilize technology or AI to have some of the quick response when a resume is submitted, scheduling ease of interviews and things like that. We don't currently have those technologies. So that's something that I think would augment my team to then give them more time to have more in-depth phone screens, more time with hiring managers to understand the position. We really want to work on realistic job previews so people understand the role. I'd love to have videos of some of our higher volume roles so people can see what they would be doing. So things like that, just to augment the experience.
Yeah, I think that is such a great, giving people a visceral, real sense of what it's going to be like to have a job, as opposed to selling them, the brochure version of the job. That in the end doesn't do anybody any favors, neither you nor the candidate. And so I think that's really smart. And I hear a lot of smart talent leaders thinking in that direction. Okay, we're going to move now. At the end of each episode, we love to do a rapid fire session of questions. So I want you to envision yourself getting in the elevator at MGB and having the CEO of that hospital, the CEO of the whole system happens to get in the elevator with you, and you only have a minute until you get up to the floor where you're both getting off. So if I'm the CEO, what is the most successful tool the TA team uses today to help you with your job?
Talent acquisition partners, my team.
I love it. What is currently, if I'm the CEO and see you, hey, Jackie, what is currently the biggest challenge your team faces?
I would say current state, it would be a lack of allied health professionals. There's a supply issue. We've tried all the different recruitment techniques and tricks and job boards and everything, and we just have not been able to make a dent in that. Yep. So that's an area where I think we need more robust training programs and more information and access so that people know these roles exist. Like when I was in high school, I had no clue what a X-ray tech was, or I just don't think that students know to go in those fields. And they also pay pretty well. So it's a nice job if you only wanted to do a certificate or a 2-year program, and you could start making good money pretty quickly.
Okay, so back to being in the rapid fire in the elevator for 1 minute. Jackie, as an executive, as the CEO, one of the most important things I do is interview people, but you're the pro at this. What's your number one tip for making me a better interviewer?
Preparing. So having your questions ready, making sure if you're doing panels that everyone has one assigned, have a rubric so that you're scoring and we're reducing bias in our interview process. So for me, it's just the effort that goes into it before you pick up the phone or before you meet with the person. I think a lot of our hiring leaders, they only interview maybe once or twice a year. And so to think that you're just going to walk into a room and not be rusty, it won't work. So take the time, look at the resume, craft questions, be thoughtful.
Love that. Jacquie Liddell, it's very clear why you're a talent all-star. Thank you for joining us today and sharing all your wisdom and insights.
Thanks for having me. This was great.
That's Jacquie Liddell. She's the VP of Talent Acquisition at Mass General Brigham. We'll put her LinkedIn profile in the notes below. And just a reminder, we're an audio podcast too. So if you want to listen on the go, just search Talent All-Stars in your favorite podcast app and tap follow. And if you have feedback for us or ideas for future episodes, send us an email at talentallstars@ziprecruiter.com. I'm Dave Travers. Thanks for listening to Talent All-Stars. We'll see you back here next time.